As Christians, we are called into God's healing and restorative work in the world. Following Jesus means advocating for and advancing the well-being of all people, not only physically, but mentally, spiritually, socially, financially as well. Your Abundant Health team in Western PA is committed to leading clergy and laity in prioritizing health and wholeness individually, for your congregation, and for your communities, so we all may experience the abundant life that Jesus has to offer us.
To be physically healthy is to be able to do the work of God, to be able to serve lunch after church, to work the local mission project, whether in our district here it's building ramps for homebound folks, to maybe packing clothes at the local thrift store. It's also maybe working in the food pantry. To be physically healthy and mentally able to mentor the next generations of believers. If we are poor physical health, this becomes a concern for our communities of faith. For example, when a member of church has cancer, it does not only affect the individual, but those around them. However, we can be good stewards of our health by attempting to prevent illness and disease.
We were asked the question, why did we do this? For me, I couldn't preach anymore about treating your body like a temple if I wasn't disciplined enough to do that for myself, and I was no longer able to care for people in a way that I should be able to care for people. So there were a couple reasons why I went to the doctor, and he helped me develop a plan, took some data, and sent me to his nutritionist, and they helped me with a new lifestyle change of nutrition and exercise. And over the course of a year and a half, I was able to lose 70 pounds.
I was morbidly obese. I was pre-diabetic, and I joined Kendra last May, and we added a GERD diet in as well. And I had the goal of burning 1,000 calories a day more than I took in, which I did. And over the summer, I lost 89 pounds. And like Kendra said, this was a lifestyle change. And it was one that it's not looking for a magic number, but being healthy. And now my new guide along the road is having a size 36 pants, which I'm in, and a size 17.5 shirt.
One of the things that I do there and we talk about frequently and we work with is having good and abundant mental health and knowing how to reach out when we don't have those things and what to do. And the most important part of that is understanding that life gets messy, and that's okay. That when we struggle in our own mental health and with depression and these kinds of things, that can be hard. And it's okay to reach out. It's okay to get help. But the other part of that is knowing how to get the help. And so we have within our conference the EAP, or the Employee Assistance Program, that helps us when we need help. That at no cost to us, it offers us 6 sessions. And we know that sometimes that might not be enough. And if that happens, you can reach out to your district superintendent or the benefits office and find more resources available for you. The information for the EAP is here on your screen, and you can use that to reach out however you may need, when you may need.
Hi, another aspect of our Abundant Health team is also looking at financial health. And financial health is also important because it helps us with our overall health and well-being. And in this past year, Reverend Jeff Vanderhoff offered a class to clergy called Saving Grace. And in a moment, he will explain a little bit of that class. But as a team, we plan to develop this area over the next year and include laity in achieving financial health.
If you're anything like me, you deal with a certain level of stress on a fairly regular basis. And if you're anything like most people, that stress comes through one of 4 primary sources. It's what I call the 4 lines of stress: headlines, deadlines, lifelines, and bottom lines. And by bottom lines, I'm referring to financial stress. And if finances are a source of stress for you, I want to encourage you to take a class on this curriculum put out by Westpath called Saving Grace, a guide to financial well-being. It is a 6-week class that offers a roadmap to putting together a spending plan that is biblical, Wesleyan, and practical. And I believe that by following those 6 lessons, it will lead you on a path to financial well-being.
We are a part of God's creation. We are tasked to care for it as well. Creation care means responsibly interacting with the world and advocating for all God's creatures and earth. We invite you to read paragraph 160 of our social principles on the natural world and consider how you individually, locally, and beyond can help to take steps supporting and healing the world around us. COVID also offered a stark glimpse into environmental health. Being cooped up at home, many of us realized just how our surroundings can impact our health. Some of us struggled with isolation, while others craved respite from a busy home. Still others struggled with living in an unsafe home dynamic. Limited transit and store closures made it difficult for us to have access to food, healthcare, and work. We know access to healthcare varies based on race, socioeconomic status, and more, and that environmental pollution contributes to increased levels of asthma and some cancers. So as we move forward, your Abundant Health team recognizes that the environment is not just something out there beyond us. We are a part of the environment, and our environment impacts our mental, physical, social, and spiritual health.
Imagine 3 legs to a table which is laid as a formula for healthy living. Those 3 legs, of course, would be physical, mental, and spiritual. While some of us might look at our Fitbit or other tools to measure and look for answers to becoming healthier, those 3 legs to me compose the truth and the answers we need. It includes servanthood to others as a basic for living. God plants in each of us a love for and a need for a relationship with Him. One of God's highest priorities is a relationship with us. Beginning and ending each day in humble obedience to God, I think is a real great start towards abundant life. Then add the above exercise, and the table is ready for weight bearing to give us a level playing field. Romans 8:6 said, "For the mind is governed by the flesh is death, and the mind governed by the Spirit is life and peace." Proverbs 13:10 reads like this: "I challenge you to consider the spiritual and moral track record of anyone from whom you obtain important advice or counsel, especially if it affects decisions you make about your family or your future."
It was a really exciting time. Abundant Health was a new initiative in Western PA, and we had volunteers gathered from across the conference, people dedicated and passionate about health and health ministry and looking to advance that in our Western PA UNC churches. But it was also a little daunting. Abundant Health, what a big umbrella. Where would we even begin? Where would we start in this endeavor? Well, little did we know a global pandemic was right around the corner. And as concerns about COVID-19 began to emerge, our team quickly found its place and calling in ministering to our conference.
Our team jumped right into learning as much as possible about the virus and finding the best way to communicate that to our churches, including videos and presentations, blogs and emails, guidelines and graphics. We wanted to make it possible for each community to interpret and apply the public health guidelines to their unique setting. In a year that has been so challenging for all of us, so much loss and suffering, sickness and death, loneliness and isolation, uncertainty and anxiety, Our team has remained inspired by our churches and their adaptability and flexibility in this ever-evolving situation. Our churches had to sacrifice so much of what defines us as the body of Christ, gathering together, sharing meals and the Lord's Supper, passing the peace, hugs and handshakes, singing together in worship.
And truly, our team has been in awe of the sacrifices that our churches have made to keep themselves, to keep one another, to keep their communities safe at this time, weighing out all the risks while still finding ways to keep the church moving forward, to keep people connected. And now, as we move into our new normal, feeling so hopeful as more people are able to be vaccinated and have been vaccinated, our team remains committed to helping churches through COVID and beyond find ways to stay healthy and to thrive physically, mentally, spiritually, socially, financially, and to live into that abundant life that Jesus gives us.